This week, Governor Tim Walz says he thinks a rescue plan for HCMC will get through the legislature, and more on plans for a state-run pediatric mental health facility. Welcome to the April 24th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. Governor Tim Walz said this week he would support a rescue plan for Hennepin Healthcare after meeting with lawmakers Wednesday for another round of end-of-session negotiations.
There's a lot of positive agreement that is an incredibly important asset. I think we're still, and I feel a little better than I did 10 days ago, but there's still more work to be done. I think the first thing we need to do is truly identify what the entire problem there is and how we get it, and I think that's bipartisan agreement.
The governor added, however, that the full funding request by the hospital was not in the budget now. Some lawmakers said last week they also wanted governance changes before they committed to any money. Walz sounded supportive, but wouldn't commit to a clear plan of action and did not mention a proposed statewide uncompensated care fund currently moving through the Senate, but not in the Minnesota House. Time is running out for any solution. There are only 3 weeks left in this year's legislative session. Hennepin Healthcare says a $200 million budget gap this year could force the hospital to close. Walz also said the state is moving forward on information systems to implement new work requirements for Medicaid. The state has struggled with major system changes like the MNLARS driver and vehicle system that had to be scrapped in 2019. A recent audit also flagged what were called significant concerns about a new online DNR licensing system.
I feel the sense of urgency they have of investing in getting this new system, but the one thing we've learned is you can't launch a bad one.
This week, the governor also made time for appearances on MS Now and Jimmy Kimmel's late night show on ABC. Walz told Kimmel he was writing a book about the state's response to the Operation Metro Surge immigration crackdown. He told MS Now host Michael Steele that he also thinks Democrats need to seize the initiative again on health care in the coming elections.
I mean, when we take power back, I'll tell you what, the next Democratic president better figure out a way to get universal health care. We're back in the same situation again. And it better improve the lives of those rural hospitals.
Back in St. Paul, the House Capital Investment Committee this week heard a measure that would dedicate $7 million to planning for a new state mental health treatment facility for kids. Rochester DFL Representative Kim Hicks said the plans were for a new 30-bed secure psychiatric residential treatment facility to be operated by the state's direct care and treatment system. Kirsten Anderson, executive director of Aspire Minnesota, told lawmakers that additional capacity was sorely needed.
First, over the past 20 years, Minnesota has lost over 850 beds in residential treatment capacity. This proposals and other recent projects are building updated trauma-informed and responsive treatment models that are greatly needed. Second, acuity of children and complexity of systems continues to increase here and globally. We need to develop capacity throughout our continuum to meet this trend.
Hospitals and care providers have been calling for more pediatric mental health treatment options, as too often the alternative is boarding in emergency departments. Officials have cited that as a major contributor to the nearly $500 million cost of hospital boarding in Minnesota annually. Also this week, the Rochester Post-Bulletin said that Minnesota hospitals reported more than $3.3 billion of unpaid care to Medicare and Medicaid beneficiaries in 2025, the bulk of $6.5 billion in community benefits hospitals counted last year. That top line was up 5% over 2024. Hospitals reported another $342 million in charity care, up 40% over 2024. And did you see the story about the North Memorial EMT who has been working in ambulances for 50 years? WCCO this week profiled Steve Nesseth of Faribault.
Volunteers were needed in my hometown, Kenyon, just 15 miles east of here. Kind of a quasi thing between the fire department, the police department, and anyone else who wanted to help.
He said things now are very different from those early days.
We showed up at the hospitals back in the early 70s, up to the middle, unannounced. So we just walk in with a patient.
At 72, Nesseth told WCCO he's going to keep doing the work as long as he can. And finally, a couple notes from Washington. First, President Donald Trump signed an executive order Thursday reclassifying medical marijuana, shifting the drug from Schedule 1, reserved for drugs without medical use and subject to abuse, to the less strictly regulated Schedule 3. It doesn't legalize the drug, but will be a major tax shift for producers and may open up some cannabis research. Also, the conservative Paragon Health Institute is out with a new report highly critical of U.S. hospitals, blaming them for sharp increases in health costs. Paragon President Brian Blades was on C-SPAN this morning and encouraged lawmakers to enact site-neutral payments to drive down health costs.
The Medicare and Medicaid program will both pay more for identical services provided in a hospital than in an independent physician office, like much more.
Paragon was a key force behind efforts to cut back Medicaid's state-directed payment programs last year, which has delayed implementation of Minnesota's program. That's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson. Thanks for listening.